Hello, everybody. This is Susan Clinton, and this is this week's episode of Tough to Treat. I'm here with Erica as a surprise on our intro. Usually just one or the other of us is doing the intro at a time, but we have some cool announcements we wanted to make before you launch into listening to podcast number 73. So, Erica, hi.
How are you? I will take
Good.
it away. Good. I will just take it away briefly. First of all, we want to thank everybody for leaving us a testimonial and a review. And we can't thank you enough. It really means the world to us. And if you have not done so, please leave us a review on iTunes and wherever you listen to podcasts, as well as YouTube. We appreciate, if you like and subscribe to our YouTube channel. We not only have our podcasts on there, but we have several live videos that we've done over the past couple of months, ranging from exercise foot progressions to adverse neural tension. So if you can please do so, we would appreciate it. And we would like to thank a few people who've left us testimonials. We have a little announcement coming up at the end here, but I know we've been asking you to leave us testimonials, and I want to read just a few as a shout out to Laura SDPT. She left us one called a critical thinking engine. And this is what she wrote. She wrote, "I recently found this podcast while on the hunt for a podcast to keep me engaged and my mind pondering. I've been a physical therapist for 10 years and admittedly caught in a rut or routine with patients. I love the critical thinking involved with the cases shared, and I've been able to utilize the clinical pearls to benefit my patients and practice. This bi-monthly podcast is an invaluable listen into the minds of two experienced experts in the field of physical therapy. I recommend highly to all of my colleagues or any member of a multidisciplinary health team. Thank you to both the hosts for their leading work in the field." And that's Laura SDPT. Thank you, Laura. And
Thank you, Laura.
yes, fantastic. And a couple more. Consistently good content from master clinicians by ShePT Jill. I always learn something from each episode, and as an ortho pelvic PT, I love that they utilize many tools in their approach and gives me a lot to think about with my own practice. So that is Jill. And from Nellie DPT, excellent podcast. Great critical thinking is used. I love the holistic approach and the presenter's ability to look for the drivers/initiators rather than focus on treating the symptoms. Great evaluative tools and treatment tips are shared. I've learned a lot of new ways to assess and treat my patients. Thank you, Susan and Erica." And finally, the most recent one from Nina09906. "Love this podcast. This is exactly what I was looking for. So many great pearls and tips that I can apply immediately. Love it." So it really...
Thank you, everyone. That's fantastic.
Totally.
So what do we have lined up for those who have actually left us reviews?
Yes. So we're coming out with a webinar on probably mid-June. So look for that in your email on learning how to treat the complex patient. And everybody who's left us a testimonial, so if you have not done so, please do so as soon as you can. We will be putting everybody into a drawing for a free access to this webinar. And it's got some really great stuff in there. And I know that you will learn a lot. So please leave us a podcast and look for this, the webinar coming in mid-June.
Mm-hmm.
So
thank you. Thanks for joining me, Erica, for the introduction. What you're fixing to listen to now is podcast number 73. And in this particular podcast, Erica and I are going to discuss the use of those three powerful questions again on a client that I was working with that had abdominal and pelvic pain in the immediate postpartum era following a C-section. This was all done in a telehealth session, and it just really helps amplify and show that we are so effective whether we're working virtually or we're working in person with our clients. Have a listen, and as always, leave us your reviews on iTunes. Join us on our YouTube channel and like and subscribe. Thanks so much. Hi, everybody. Welcome to Tough to Treat. I'm your co-host, Susan Clinton, and I'm here with Erica Mello. Hi, Erica.
Hi, Susan. How are you?
I'm good. Welcome to podcast number 73. So,
73.
anything you want to say today before we get
Today,
rolling, Erica?
I wanted just to welcome any new listeners that we have, and if anybody hasn't left a testimonial on our iTunes, it'd be fantastic if you did. And I've been really enjoying, this is, as we're filming this, we're in, I don't know, week 7, I think, at home here, and it's been great. Actually, I've been listening to old podcasts, our old podcasts, and it's been great connecting with people, and we really hope that you enjoy listening.
Yes, and we have made some changes to our website and continuing to make some more. We're actually grouping together some of the most listened to podcasts so that you guys can find that. We're working on our email list and getting more information out. And we have a Facebook group, which we'd love if you're not part of it. Join us, because on our, I think, did you put it on the YouTube channel?
Yes, I was just going to say.
Yeah, go ahead. The Facebook Lives that we've been doing,
Yeah.
we've done 6 of them so
we've
far,
done
I think,
6.
up to this date. Yeah.
Yeah, they're on our YouTube channel, so you'll see our normal graphic for all our podcasts go up on YouTube as well, but you'll see our just normal tough to treat graphic. The Facebook Lives have a different graphic. They're definitely they're black and white, and they are actual videos of us discussing. We have one on knee progression, adverse neural tension, thoracic mobility beyond the breath. What else? We just did one on the hip recently. Foot progressions, that type of thing, exercise progression. So,
Yep, some knee pain stuff. Yep.
Exactly. So it's tough to treat is the YouTube channel.
Yeah. So join us in all of those fun places for all of those great resources coming up. Erica and I will be actually doing a presentation at the virtual next conference. It's not live anymore. The APTA has taken it to a virtual conference. So if you wanted to see Erica and I in action, we're actually going to be recording that and sending that out, and that, I believe, still is going to be taking place the first week of June. So
first week of June. Yep.
So keep that in mind, and we'll see you soon on some of those events.
Yeah.
Okay, podcast number 73. Today we're going to be recircling around. You know how I treat and see a lot of people with pain following pregnancy, pain during pregnancy, issues in and around pregnancy and early postpartum. And this lady is one that I have been working with. And I know a lot of people always have questions about telehealth, and this was definitely one that we did over a virtual platform. She is a lady who has had her second C-section. The time I saw her, it was less than 6 weeks old. Her C-section, she'd been 3.5, maybe 4 weeks out. Her sister's a PT and told her to contact me. And so she did. And we got on, and her history kind of follows like this. She had her first C-section in 2018. And it was because of an emergency. There were some issues that were occurring, and they had to make an emergency C-section. They couldn't wait for labor to progress. So she was left without, she was left kind of she said, in a bit of a state of shock, not expecting to have had major surgery, and had her first baby, who at the time of this, at the time that I saw her, was 20 months old. So she's a toddler, the first one, and then now she has her newborn baby that's 3.5 weeks old.
Got it.
So I asked her how things were going and what she felt and what was happening, and she said the reason that she got in touch with me was because she was having back pain. And she had mild back pain in her pregnancy and some hip soreness on the left side of her hip, her left hip. And the back pain was such that she has been unable to pick up her toddler. Well, she's also had a C-section. Yep. Keep that in mind. But she's had back pain so bad that as she's gotten up from a chair a couple of times, she's had terrible spasms that went from her mid-low back all the way around to her left side.
Wow.
And it really scared her. So she has that. She's afraid to pick up her toddler. Her toddler's crying for her, but she's afraid to do it. She goes, I'm afraid to do it because of my belly, but I'm also afraid to do it because of my back, more because of my back. And then she said, and I also feel like that I'm bruised inside of my body around, especially my incision and my abdomen area. And it just feels like it's sore. She knows she doesn't have an infection. Her incision is good. She showed me her scar. Everything looks happy. No, not red, puffy, no fevers. Everything is fine, except that she has this pain that she's really seriously worried about. And that, she can't, pick up her child. She wants to start to return to moving around and doing the things that she wants to do. She would like to do some more light cardio. But at this point, she's really worried about healing up properly. She feels like that she didn't have enough opportunity, or she didn't spend the time really working on healing herself properly after the first baby. And now that she's had a second C-section, she's really quite concerned. So as I got into those things, me and my powerful questions.
Quick question. She didn't have any back pain with the first one, right?
I'm sorry?
You didn't have any back pain with the first C-section?
No, the first pregnancy was kind of not really any problem. She was quite surprised that during labor, she developed these issues and these problems in the hospital during the beginning of labor, and they actually halted her labor and took her straight to the OR to do the C-section.
C-section. Okay.
So there wasn't a lot of time to think, to say anything. It was like the decision was made.
Yep. Okay.
So, for her protection and for her child's protection. So, but she never really said that, there wasn't anything else that was going on before her first, during her first pregnancy. She really didn't have any pain. Postpartum, she didn't really comment a lot about any pain, other than it took longer than she thought it would after having a C-section to get herself back up to speed. She thought she was healthier than that. She was surprised that it took as long to recover as it did, as most people are. And that's why she really wanted to jump on this and say, I really want to do everything I can to optimize my recovery the best I can. And she said, it's not that I want to push myself too hard. I want to just do the things that I really need to do to make sure I'm okay. So, and that's what that was her answer to my question of, what do you expect? What are your expectations? What do you want? What is it, and so that was her answer to that. What do you think is going on would be one of my other powerful questions. And she said that she felt like that she had probably done something to her back while she was pregnant, and that now it's not responding to anything that she knows. And in fact, it's getting much worse, and she's afraid that she has some sort of weird thing, that like a disc or something else, that's progressing. And so I just said, well, tell me a little bit more about that. I want to hear, where, tell me more. Why are you, what happened in pregnancy? Just tell me more. There's more to this story. Well, she said that she felt like she was like with her toddler, there was a lot of lifting and twisting. And she goes, and then everywhere I read, they tell you shouldn't bend over and twist. Here we go with those stories again, right?
Right.
And but she said, and she goes, my sister's a PT, and she did tell me that probably that I didn't have a disc, and that, told me that everything was okay, that I just was having a lot of trouble with back pain, and that it's really not, that you need to see somebody about it. And she said, at first I was a little bit mad that my sister wouldn't treat me, but then I finally kind of get it, and I said, so she goes, so that's why I called you, because she said she trusted you and I should come and see you. So she's worried about something really creepy in her back.
Yeah.
She's worried about that. Her expectations is that she wants to heal up really good and appropriately, and optimize her health and her movement system. So of course, here comes my big fear question, in your heart of hearts, what are you really seriously worried about?
Yep.
And, it took her a little bit of time. She kind of got past the back piece of it. And she said, okay, well, I've been cut into twice, and I have heard stories of people saying that their C-section scars have ruptured, or C-section scars could rupture if you lift too many heavy weights. And I was a weightlifter before I got pregnant, and I want to go back and return to heavy load lifting. I love doing it and I want to do it, but I'm afraid that my scar is going to rupture.
Wow.
Okay.
So you get, what do you expect?
Yeah.
What do you think is going on? And in your heart of hearts, what are you afraid of?
Yeah.
Those are very powerful questions.
Yeah. And it's important, again, we did this once before with somebody who was pregnant and her pelvic girdle pain, and some other people that we've talked about, and you've talked about this too.
Yeah.
What are people wanting to do? What do they want? And what are they worried about?
Yeah.
What are they really worried about? So this is really important because although her expectations are to heal up good with her pregnancy, her long-term goal is to return to heavy-duty weightlifting. And I need to know that because PT needs to align with her vision.
Absolutely.
If it doesn't, it's not gonna. It's gonna create ambivalence with her. I really need to know what it is they want to do and what they're deeply afraid of. Yeah. So we spent some time talking about where that fear came from, where she heard it. We talked a lot about I just said, do you want to talk a little bit more about this? And she did. She was really worried about this. And I said, let's just talk a little bit about the physiology of scarring and what that is and why a scar is a scar. And that, that this isn't a typical thing that you would hear about rupturing, like a hernia repair or something else. It's in a different position. There's just different things about it. And that I can sit here and tell you how unlikely that is, but I think one of the things that we can do is let's see if we can't just figure out what's going on with you in your movement pattern and see if we can't restore confidence in your body again so that you don't have that fear. Mm-hmm. And she was all into that. She loved hearing about the scar and what a scar meant and how it worked and, and that the goal was to get the body to move, the scar to move with the body, so that it became part of the normal body movement again and wasn't the piece that she was moving around. And so at that time, it was really interesting because she admitted a lot of things like, I don't really want to touch my scar. I don't like it. I get in the shower and I wash real quick and then I barely touch it and I'm not interacting with it at all. And I've heard that maybe I'm supposed to be doing some sort of scar massage. And I said, okay, well, we'll get there. That's good to know. That's good to know. I said, what creeps you out about your scar? And she goes, it just feels like it's not part of me.
I was just going to say something like that. Yeah. Mm-hmm. It's like another part of her, like a part, the part that needs like a separate part, basically, for lack of a better word.
it's been disembodied from her.
Exactly.
Her body. It's very much like David Butler will talk about.
Yeah.
She needs to fall back in love with her abdomen parts again. Yeah, yes. Her parts again. So anyway, so off we went into let's do you have any other questions before we head into the exam?
No, good.
Okay. I asked her a little bit about the left hip soreness and things like that, and she said since she was a child, she has always been told that she had something wrong with her hip and they were going to put her in a brace, but they never did. Then instead of sitting cross-legged on the floor like most children, she would sit with the right leg, kind of in the cross-leg position, but the left leg would go behind her.
Oh, so, like in a W sit.
Yeah.
Oh boy.
On the left, but a regular sit on the right. So she kind of windswept.
Right. Yeah, exactly.
Yeah. And she says, to this day, I can only sit on the floor so long because my left hip bothers me, this and that. And then she said, and that I think that kind of like goes along with my back pain. I said, okay, so let's take a look at things and let's take a look at the hip and the back and see, is that where you want to go or do you want to go to your abdomen first? Where do you want to go first? She goes, let's go to the back because this spasming thing is just like worrying me. So I asked more questions around that. About that and what was happening there. And, she really didn't have a lot to say other than when she did have those really bad spasms, they left in about 5 minutes, but they scared her really bad.
And that would happen. No, sorry. Go ahead, Susan. No, and that would happen going from sit to stand.
Yeah. After she was sitting for a while when she would go to stand up. So I said, well, when else does your back bother you? Well, it hurts me when I stand. Okay. Does it hurt you any other time? Well, that time that I was telling you about when I go to stand up, sometimes it bothers me. And I said, any other time? And she said, well, when I'm carrying my baby, it bothers me. I said, okay. So just show me how you stand and grab your couch pillow over there and show me how you hold your baby. Let me just see it. Let's just see the
Yeah.
position, you know. And so she did. She stood, and then she grabbed the pillow and she stood. And I said, so just hang there for a minute or two. And we did. We were talking, and she goes, yes, now I feel it. And I feel it, you know, kind of in my low back, coming across my low back. And I said,
Okay.
okay. You know, in the position she was standing in, she
I
was
was just gonna ask.
basically kind of doing the post-pregnancy kind of pose where her thorax is tilted upward. She's into a lot of lumbar extension or, you know, extension compression onto the lumbar spine. A lot of quad strategy, you know, just kind of standing, you know, kind of in a lean back position, sway back, lean backy position.
Yep.
And I said, well, okay, what happens if you just change the position on your feet a little bit? So where do you feel like you are on your feet? She goes, you know, just tell me, are you on the side of your feet, the front of your feet, the back of your feet? Where are you? Where, you know, and she said, I'm really more on my heels. And I said, okay, so what if you just allowed yourself to get onto the whole foot? Like, not just, I don't want you to come off the hill. I want the whole foot on the ground. Like, see, can you distribute the weight evenly on your feet? So she fiddled around with that a little bit. And I said, how does that feel in your back? And she said, that's helping a little bit. And I said, well, that's good. So quick changing of some postures can really make this have a change pretty fast, right? And she said, yeah, but I feel like I'm slumping over. And I said, I know what you feel like because your brain is used to you being back there. So it's going to fight you a little bit on this. But let's just go with your symptoms in your back, though, because I know you feel like that you're slumped over, but you're really not. We'll look in a mirror in a minute and see that. So I just said, okay, so let's just do this. Put your hands on your hips and lean backwards. Yes, it increased her pain. And it increased her pain when she went over into right side bending. I'm sorry, no, over into left side bending.
Left side bending.
Yeah. So, and I said, what happens when you bend over? Just bend over. She goes, nothing. And I said, okay. Did it make your pain better, worse? She goes, actually, it feels good. I said, that's interesting. Why don't we bend over 5 times? You know, let's do a few bend overs. And then she did. And I said, now, how does it feel standing? It feels better. Bend over a few more times. How does it feel now? It feels better. I like the bending over. It feels really good. And I said, okay, put your hands on your hip and lean backwards. And when she did, she said, I still feel it, but nothing like I did before. So just that fast, we were able to come up with a test, retest, you know, the test exercise and then the reset. So if you're hurting and standing, what do you need to do? And immediately she goes, I need to do a few bend overs.
Right. Yeah, reset your system.
Yeah. And how do you need to change a little bit if you're holding your baby and you're standing? I need to come forward on my feet more. You know, so she was already starting to kind of pull it together a little bit here, which was great. Because I want her to have these strategies in her head that are something easy sneezy that she can do.
Yeah.
So we kind of spent a little bit time, you know, talking about that. We did some fun things, which was, you know, go ahead and lean back again into kind of that almost painful posture and try to take a, you know, just take a deep breath and just feel it. You know, again, I'm going to go into the Eric Franklin consumer comparison that I love so much. Just feel it, feel the breath, feel everything, feel where you are. And I said, now move into that position where you feel your feet more on the ground. And, you know, get yourself there, you a little less back pain, you know, so she did. And I said, now take a deep breath here. And she did. And I said, does it feel different? And she was like, yeah, it does actually. She, you know, she could comment on how it felt different and all of that. And I said, this is important because you can breathe in both of those positions, but which one feels better? Well, it feels better to me here. And I said, okay, that's great, because if you can associate your breath feeling easier in this position, your brain's going to love that. It's going to want to go there. Yeah. Self-check, exactly.
Yeah.
And, you know, I'm thinking about just the whole system. I'm also thinking about the abdomen, because if we're standing in a position where we're kind of sway back or like leaning back, what's happening to the abdominal muscles? We got quads strategy going on, but we also have a lot of gripping of the upper abdominal muscles to hold us up in that position. Those are the muscles lined up under gravity. Right? The posterior aspect is not. You know, it's a whole anterior process that's lined up under gravity. So just trying to change that a little bit for her, because one of the things she complained about was her abdomen and the pain and how she felt on the inside. So, I wanted to kind of start connecting the dots there, but, kind of keep with the back thing because that really was what was scaring her. So we kind of did some stuff, and then I said, so let's see what happens if we can just, get you to lean over a tabletop or get on your hands and knees. And so she decided that. She goes, I'll get on my hands and knees because I like getting on and off the floor because my kids are on the floor. It's like, great. So she got on her hands and knees, and we just played around with a few things. I said, if you go into like cat-cow, I hate those words, but that's what everybody uses. So if you go into the saggy back, thing, she goes, yeah, I feel that in my back a bit. And I said, what if you come out of that? That feels better. What if you arch up like a cat, or round up like a cat? Oh, that feels good. And she liked going back into child's pose. Those things felt good to her. Easy stuff to do. I said, these are great things for you to do. If you've been standing a little bit or holding, you can always get on the floor and do some of these, or don't be afraid of these motions. So, and, so then we kind of just played with holding her back kind of still and letting her belly drop and relax. Because she was gripping her belly so much with that, and it, some of it is probably brain protection. 2 C-sections. One of them was an emergency, from way back when. I'm not going to play pop psychologist, but there has to be some protection going on there, and rightly so. That's the system's job. But the other part was just because of the position she was in all the time, she was always like that. Those upper abs were in a position to always be told to work. So I wanted to get her in a position to where she could like actually let that abdominal wall go without having to like sink into her back. So, she could hold her back, kind of like a tabletop and just let the abdomen droop. And so we played with that a little bit. And she goes, this is actually making my stomach feel better. And I didn't even tell her because we were working on the back. So, and it's like, isn't it great when it all works out like that,
I was just going to ask you, how did her stomach feel, in her scar? Because I love the hands and knees position. And for her to get into that position, and we talk about this all the time, you change the context. And you're like, oh, it actually feels better.
Yeah, because it's in a position where it doesn't have to work so hard.
Yeah.
And even if she was working it a little bit more, it wasn't working nearly as hard as she was in the standing position.
Yeah,
or
for sure.
in the semi-reclining, leaning back breastfeeding position. That she was doing. So it was different. So we gave her some different things to do. And I said, so how do you feel about... I said, before we end, I know that we probably, your scar looks really good. It's very healthy. It's healed very well, but it's probably time to get it moving a little bit, and how would you feel if you could, how do you feel about touching your scar through your clothes? And she was like, oh, I can do that. So I said, well, let's just do that. So she laid on her back, bent her knees up. And I said, let's just go ahead and, just put your fingers lightly on your scar and just discover it through your clothes. And she did. And she said, this is okay. I can do this. And I said, great. Let's do something a little bit more fun then. Just keep your fingers there through your clothes on your scar. Don't press. You don't have to press hard. This isn't about like, moving things like crazy. But I said, just keep your fingers there, in that position on your scar. And I said, and just roll your knees to one side, lower trunk rotation is what we did. And so she would have her fingers on her scar and her legs would roll over. So she was basically holding her scar still while she mobilized her body, mobilizing the scar rather than
going in the back door.
Yeah, exactly. Instead of pushing him, pulling on her scar. So we did that. We did legs straight, rolling them in and out. We did knees up, the legs going out and then together, the butterfly wings, and we did lower trunk rotations. I like all of those because it's good for the back, it's good for the belly, and they were it's great for the trunk and diaphragm and rotation. And so all of that was going to be good for her. Plus she wanted to have movement things to do because remember?
Very dynamic.
Move. So I left her with that and said, be at peace, see how this works. You know what you need to do, and we'll get back together next week and see how everything goes. So she had her thing. She was going to do bend overs whenever her back hurt. She was going to, hold her baby in some different positions. She was going to start doing some of the easy scar massages, and she was going to get in positions to let her belly go.
And the on all fours,
So we kind of just left it at that. Any questions there before I go into what we did next?
No, I love the, it's really interesting for me. I don't see postpartum that much, certainly not 3.5 weeks out. And I mean, people always say once postpartum, always postpartum. I agree with that 100%. But I don't see them that early for sure. So I think that I have noticed that even in my patients, actually with one of my patients, we had her on, Jackie, remember her? We had her on the podcast, the leaking podcast. I have to go back. It was Leaking and Running was the title. She was running on her heels. What is it? I mean, I know it's because they're on their heels because they're pregnant, but how come these mothers can't get out of that strategy post delivery?
It just becomes kind of a dominant strategy for them to hold themselves up, and there's no reason to change because now they have a baby on the outside. That they're carrying in those same positions. So
true.
Unless there's a environmental impetus to change, usually we just kind of like, hey, it's a movement pattern we have, and until we get symptomatic, you're not really going to have a need to change it somewhat.
I mean, and they use that same movement pattern with everything. Like she was using it with running, and I mean, it just transcends all the whole gamut of movement. So that's interesting. Other than that, I'm good.
Yeah. So the next visit, the next two visits, I'll kind of combine them together here to move this along. But the next visit, she loved the trunk rotations with the scar massage. She really liked doing it through her clothes. Her back pain was feeling much, much, much better. Only when she's carrying her child was her back hurting. She wanted to talk about her left hip a little bit and sitting. So we played around with a few things, and said you can take that pillow and put it up. She wanted to sit cross-legged. And I said, okay, so let's try it. So she goes, yeah, it's pulling in my hip. And I said, well, put a pillow under your left knee, on the side. She did. She had to put it up pretty high to get it comfortable. And I said, okay, let's do something different. Grab that cushion and put it up underneath your pelvis. So she was sitting up on it, cross-legged, so her knees could drop down. That felt fantastic.
Got it.
So she was like, okay.
So right in the back.
Yeah. So we just did a lift, and it opened her hip up a little bit easier. And life was good. And she was very excited because that meant that she could sit on the floor cross-legged and lean forward. We did things, like I said, so if you're playing a game with your daughter, show me how you would move. Does it bother you? No, this feels great. So she was, and then she could actually move off onto her knees and back onto the, so she was already starting to develop some movement around there, but she was reluctant to sit on the floor because that left hip was bothering her. Yeah. And she kept hearing that story that you have a bad hip since you were a little child.
Oh boy.
I said, let's just get that hip in a position where it doesn't have to talk to you so much and see how you feel about it. And she said it actually felt really good on her back too. So she really liked that position. And then we did some stuff with her abdominal area. She really, one of her biggest fears is having this rupture of her abdominal area. And I said, let's just start working on that. And so I started having her learn how to palpate her abdomen. And, we did some palpation around the umbilicus, with some easy curl ups so she could feel, she could feel the rectus abdominis muscle recruiting, but she could feel it pretty squishy on the inside. So, maybe the linea alba was kind of all over the place. Who knows? Maybe she wasn't recruiting enough to really get a good tension across her abdominal wall. So we started playing with some things and adding like some exhalations, blowing through like a straw with puckered lips.
Yes, I love
and
that.
Bringing that in with just like doing a little knee lift and down, like the Shirley Sarman kind of way of progressing out, lower ab activation, slightly lowering the knee and lifting, sliding the foot on the ground and doing those things, adding in the exhale. And she could feel a change in her abdomen, and which was really exciting.
Yeah, just with the exhalation you did that, right?
Yeah.
I love that.
Yeah, so because it just helps recruit a little bit more.
Yeah.
And, but in a different way. Again, novel input to the system too, right?
Yeah.
So it was funny. So I said, let's just do something really cool and different now. So we got that kind of going, and she had those few things to work on. I said, let your legs all the way out straight. She's laying flat on her back. And I thought, let's just do an active straight leg raise test on her and see what goes on. And so we did. And I said, which leg bothers you? Oh, really pulls on the left side.
Pulls.
And that's what I said, well, what does pull mean? Well, there's some pain there, and it feels like it's heavy and it's pulling. Like my scar is pulling. Interesting. Okay. I said, okay, so why don't you put your fingers on that area, where you feel that pulling, like along your scar, and do a little deeper pressure down and repeat the test. And it helped it. So the input to that area helped. So I said, let's go back up to where you were doing the, just the Sarman, kind of one knee up, sliding the leg down, those things.
Yeah.
And I said, but let's just do that same little input to that left side. Just kind of give it a little, just little tapping.
Tactile, yeah.
Yeah, a little tactile. I want her like desensitizing that scar, but I don't want to use the word desensitize because that's like something scary. So let's do a little tapping and kind of just wake up that area and see what happens a little bit there with it. And then I just said, just keep your fingers there and just kind of, massage it easy or a little pressure down as you're doing these exercises. And so she did that. And I said, now let's go back down, let your legs down and lift one leg up and the other leg up and see how it feels. Dramatically different.
Oh, fantastic.
Yeah. So now she's starting to get the idea. And I said, what's happening is, remember when we talked about we want the scar to move with the body? What we're doing now is we're just giving that area of your body permission to move, because it's being protected, and again, rightly so. It's not a bad thing, but now it doesn't need quite that amount of protection. So we're just giving it a little permission to move. So she was going to go in and add those things in. As we kind of went into the last time that I saw her, I'm not going to see her again for a few weeks because she's doing really good. Spontaneously, 2 weeks later, she was picking up her toddler without back pain. She'd already been to the doctor. She said it was, the doctor saw her over telehealth and said, no problems, great, whatever. So anyway, she just decided to pick up her toddler and everything was fine. And she felt confident and comfortable doing it. So we started adding toddler exercises to her program. Pick up your toddler and swing her down and lift her up and swing her down like kettlebell.
Oh, that's fantastic.
Some toddler rotation. Because she said that she thought her daughter would love it. She said she would love for me to play with her in that way.
Of course.
And I said, well then, and I said, if it feels too heavy, let's grade up the thing. So you pick up the toddler once and it feels fine. You pick her up the second time, not so fine. Have her climb up onto the ottoman and pick her up. So we're not having to go all the way down, so she kind of started getting the idea. And I said, how did you vary your weightlifting in the gym? Well, I would do it some this way and some this way. And I said, let's grab that strategy and use it with picking up your toddler. And so
nice.
she was thrilled because she said that her toddler was really kind of having a little bit of some, like all kids do when the new baby comes in the house, just wanted a little more mommy attention. And she'd been told no for 4 weeks, mommy can't lift you, so she was so thrilled to be able, she goes, I don't need to carry her around all the time, but it's so nice to just do that when I want to.
Yeah.
So, and then we actually got her started on plucking and rolling and mobilizing the scar. She's gotten better and better. So now she can actually get on her skin and she can move it around. 0 scar pain.
Nice.
She only feels the pulling, which she knows what that is now. And she was getting brave enough to kind of like start to do some lifting and really more, gentle mobilization, but really a little bit more than just, touching the top of it, really getting in and helping the scar move around a lot better. Yeah. And we just kept it going with the movements and things like that. Her abdominal pain was completely gone. And the only thing that kind of came up was when she uses when she has to carry her baby for long periods of time, her back pain returns. And she goes, but I know what it is. And I know, she goes, so I'm trying to figure some things out. And I said, how does it feel when you wrap your baby? Because she has a Baba wrap, which is a wrap that allows you to wrap around twice and have the baby in front.
Yes.
Yeah. And so she said that, and I said, does it feel okay? I'm not going to sit here and make judgments about does she lean back with it or not, with the baby on her. I just want to know, do you wrap your child? And when you do, how do you feel? Well, when I have her wrapped, it actually feels better. I said, okay, what's preventing you from wrapping then? Well, the wrap is upstairs in my bedroom. I said, well, where do you need to put it so you can access it more? I just need to have it down here with me. So it's just a little problem solving. And I said, how would you feel about, when you're going to have to make dinner or I said, I realize that if you're running across the house, you're going to grab her and go do this, and you're not going to stop and wrap. But when you're like really moving around, and she was being extra fussy that week, I said, can you just keep her a little bit more wrapped and next to you so that you feel better? So we talked about that. And then she was talking about, as they move forward and they start getting out of the house and doing some walking and stuff, that they have a backpack for their toddler, that her husband carries the toddler on his back.
Mm-hmm.
And she was thinking about, she goes, as soon as I guess there's an age, I think there is people out there would have to tell me that do peds. There's, I guess, an age criterion where you don't put them on your back until a certain age now.
Mm-hmm.
But anyway, she said, as soon as I do, we're going to get one for her too. And then she said something to me. She goes, what do you think about that? And I said, well, first of all, you're just going to have to try it and see. So if there's a way, once your child is, I guess whatever it is, maybe 6 months, I think, or something. I can't remember. Nobody quote me out there, sorry, or send me show notes on it. I said, when your child's of age, then you can like figure it out with a wrap and see how it feels on you. And I said, but I'll just put this out there lightly. For 3 million years, every culture on this earth has always carried their children on their backs.
Yeah. Yeah.
Across the globe.
Yeah.
And every culture. Every culture. So I said, there isn't a right way or a wrong way or a good way or a bad way. It's just what's going to be the thing that's going to work the best for you.
Mm-hmm.
And I said, so you may feel good for a while having her on, and something on your back, and it may feel good to switch it around.
In the front. Yeah.
Yeah. It's just like you don't want to always be on the side either all the time, because it may bother you after a while. So it's like anything else. It's like the way that you're varying all of the other stuff in your life, with your weights and your exercise. You just have to vary the loads that you're handling with your family too, in those ways, so that you can feel. I said, go by how you feel, and not by what this person says or that thing says or that stuff says, because there's no right or wrong. It's just you got to follow the guidelines. I guess it's something about the baby's head control, which is why they want them wrapped forward instead of on the back in the early days. I said, just follow the guidelines on that part, but once just see how you feel.
And you wonder that when she said she had it wrapped and she had it in front of her, like it made her feel better. And I'm wondering what kind of input to the system did it get her off her heels?
Yeah. What did it do, or what did the wrapping do around her? Was it that whole sensory experience of the wrap coming around her entire thorax and being, so there's so much, to like do it. So anyway, the wrap was upstairs, so I didn't ask her to go up and get it, but the next visit I'm going to have her say, let me see how that looks. I'm just interested to see, but I just want to see what she looks like with it on for my own learning, not because I want to be critical of her at all, because if it feels good, I'm in,
Yeah, what does her body look like when it's on?
When it gives her a break and she feels better, and maybe there's something about the arms coming across the thorax and, limiting the thorax or holding the thorax still that actually can be feeding into a symptomatic expression in her back.
Yes.
So I know you talk a lot about, thorax compression and, maybe thorax being held, maybe overworking pecs, something in there that could be like, kind of like, bringing compression down onto the lumbar spine that doesn't feel good.
Mm-hmm. Yes. Yeah, especially when you've got that thorax, posterior over the pelvis. And, when you have the wrap in front, yes, it does an input to the anterior chain. Who knows? Everybody's going to react differently, but it's got to go around her. And is it giving her some input in the sense
that's causing her back muscles to work differently?
Yes.
And I also think about that too, because it made me think about something that you and I kind of talked about on the Facebook Live a little bit when we were talking about the hip of all things. The last one that we did, which was I think it was the Facebook Live number 6 on the hip, was that maybe it's not the compression in the lumbar spine that's the issue, but maybe it's something not moving or being whatever it is in the movement strategy away from the symptomatic area, that once that has a freedom or a change, actually can, doesn't drive the symptomatic expression as much. So with her, maybe it wasn't her posture at all, but maybe it was something to do with how the thorax was being held. You know
Yes,
what I'm
yes,
saying? So maybe it
yes,
wasn't the compression of her lumbar spine. You know, I was just kind of postulating that in the beginning because she
yes.
stands in that, oh, it's compression. But maybe it wasn't compression at all. Maybe it was the fact that the thorax wasn't moving. So there wasn't moving going on in the lumbar spine. It wasn't any
Correct.
compression. It was just kind of a static system that just actually needed movement to be introduced to it.
Correct. See, when you needed to
Yeah.
elongate from above to get more
Mm-hmm.
lengthening, and then for
Yeah.
the anterior chain and go backwards,
And
for
so maybe the
sure.
wrap was
Yeah,
giving her that, but
yeah,
we got it to happen from the feet.
yeah,
But
yeah.
the wrap coming in on the other side, and she's wrapping the baby in front, so it's kind of like makes you think, well, that's just going to feed into that posture, right?
Right.
Well,
Yeah.
maybe the posture isn't the problem.
Right. Right now, absolutely.
It was
There's
like adding the
something.
dynamic piece to the system that really
Yeah.
got it to change.
Yeah,
Yeah.
I'd be interested to see what she looked like with that wrap on,
Mm-hmm.
just
Yeah.
because visually. And what was I going to say? That one of our podcasts we did, it was one of my patients where she has, her youngest is 5 now. She could not arch her back when she had back pain, and her drivers were her thorax and her feet.
Yeah.
So there's something to be said for some relationship between the pelvis. I mean, we all know this,
Mm-hmm.
thorax and foot. It changes how our body relates to gravity,
Mm-hmm.
and everybody expresses that differently, but that's the reason I believe those areas are so important, and they link very well to each other. I
Mm-hmm.
believe you can talk about an input to the foot, uh, and then it can change thoracic mobility, or not mobility. It can change the control, or how you can control your thoracic movements. And it's very interesting.
Yeah, I just gotta
Very
add that the bend over,
Mhm.
in the beginning, remember the bend over was like that, made it feel so much better, so fast,
Yeah.
so fast.
Yeah.
And it was a movement she wasn't going to do because she had heard and read that you never bend or twist your back when it hurts. But the bend over made her feel better. And so was it the opening of the lumbar spine, or was it the lengthening of the thorax in
Relax.
that bend over
Yes.
position that was enough to change the expression of her symptoms that fast?
Exactly. And I
Because
often
it
give
was
patients,
fast.
yes, no, immediate. And so how,
Yeah.
I often give patients that they hug themselves and lean forward, to decompress the thorax. Yes, you're opening up the facets and you're decompressing. It's a good point. Whatever, it worked.
Mm-hmm.
And but that fast, you're changing the neural expression. You don't just all of a sudden, people are like, oh, well, if it's a stiff joint, if she's stuck, or the facet's stuck in it, whatever it is, right? You
Mm-hmm.
can't make you can't make a change that fast and
Right.
call it, oh, she got unquote unquote, I'm even gonna say it, unstuck or whatever. It's ridiculous.
Right. Right.
It's
So, but my point and I agree completely. But my thing is that I could look at that and say, oh, see, we unweighted the lumbar spine. And
mm-hmm.
indeed we did. But was it that made the back pain change, or was it the lengthening of the thorax?
Thorax, yeah.
Don't know.
Don't
That's the
know.
whole idea, is that, kind of, or was it because it made her tilt forward onto her feet to bend over?
Right.
So we've got three
Foot,
different kinds of
the
inputs that are
lumbar,
coming in.
the thorax, yeah.
Uh-huh. And a movement that she had to
And
kind of learn to not be afraid of all at the
yeah,
same
at
time.
the same time. Yeah, it's just fascinating. It's really
Mhm.
fascinating. And you did all this virtually? This was a virtual, right? The whole
Absolutely.
thing?
The whole thing.
Fantastic.
Yeah.
Yeah, yeah. It's
So
amazing what you can do virtually, really.
what we can do with people far, far away, or
Totally. It's,
people
I
who
think,
can't come because they have a new family and they
yeah,
can't get out of the house, or because we have a pandemic going on. So
yeah.
yeah,
I know. I
it
had a patient this
is.
morning tell me I had no idea that you could do so much virtually, and I think we're all finding out that we actually can.
Yeah. Plus, the clients need to buy into it and see
Yeah.
that, and we need to demonstrate to them that movement is movement is movement is movement, and get out of our comfort zone of having to be right in the same place with them. There's so much value to being in the same room with your client, if nothing else, just the physical presence.
Yeah.
Mirror neurons, we all have that. All that stuff works. But there's some stuff we can do for people who just absolutely can't get in. So as we go down
Yeah.
the road, there's always going to be a place for them to be with us,
Yes.
in our clinic with us, but there's also going to be a place for those who can't. And
Yes.
that's the best part about all of this, is really being able to be flexible practitioners, so we can meet our clients' needs wherever they are. Okay.
Absolutely.
Thank
Great
you.
stuff. Thank you, everybody.
Take care,
Bye.
and we'll see you on the next podcast
See you on the
or
next one.
live.
Sounds good. Bye.
Bye.